for the question answer session on the Nasya. Hope you have all listened to the recording of the sir's previous lecture. Sir has answered maximum questions there, but since there might be some other questions, practical questions also, so that we can discuss today. Yeah, you can post your questions now also. Better to post in the chat itself, chat box itself. The few of the questions are there. They were in the WhatsApp group before, so we will start with them first. Sir, direct question answer शुरू करो.
Let Hima preside.
Fine.
Sir, whatever was spoken that day in the lecture, if you feel you have any missing points and you would like to add, or the things which were not spoken because there was lack of time that day, we had restrictions of just 1.5 hours. So if you would like to add to those points, then please add, and then we will start taking up the questions.
Yeah. Namaste all of you. We will try to introduce certain points as and when appropriate stage comes along with questions and answers. So we will not take it separately, but in allied way we will take it. Right? So we can start now.
Okay, sir. All those questions.
I think before whosoever has asked the questions can ask the questions directly, not in a chat box. Let the questioner be seen on the screen.
Hello, namaste sir. Am I audible?
Namaste. Yes, audible.
Sir, कैसे हो आप?
बढ़िया बढ़िया है. When you are there,
very nice to see you, sir. Sir, my question is, अगर पेशेंट को सडनली कुछ ट्रॉमा हुआ है, एक्सीडेंटल है या फिर किसी वजह से उसको अक्यूट पेन है, तो उस वक्त हमें नशे के लिए नशे के बारे में कैसे सोचना है और उस वक्त हम लोग नशे दे सकते हैं क्या?
Injury, where exactly the injury has happened? Is it brain injury or anywhere else in the body? Anywhere else in the body there is no problem. Ultimately, what medical science would do is to give painkillers.
Okay.
To reduce the pain, to reduce the inflammation, and antibiotic, and appropriate surgical treatment if it is required, like suturing or surgery. Right?
Okay.
Except any brain injury, I mean head injury.
Okay.
There also Nasya can work, but in that case we will take up first head injury. Now, depending on the clinical examination in head injury patient, you have to make sure that head injury has resulted into bleeding, intracranial bleeding or subdural bleeding. Then you have to differentiate accordingly. Once the bleeding has settled, or if there is a sharp injury in the head involving the brain. What is that? अवधूत मला समजणार नाही, कोणी बोललं का मध्ये काय इन्स्ट्रक्शन काय दिलं?
नाही सर, इट वॉज बाय मिस्टेक सर. तुम्ही कंटिन्यू करा.
Okay. If the head injury, suppose there is bleeding in the for some reason, either there is a intracranial bleed. In that case, you have to allow the patient to settle down once the bleeding stops. Make sure bleeding stops by making appropriate investigations like MRI or MR angiography. Once bleeding has stopped, then that blood is no more a blood. Then it acts as a foreign body, like any other foreign body in the body. Right? So if that is the situation, then you have to clear off that foreign body, like you have to clear off that extra blood which is outside the blood vessels, and it may be having effect as a mass effect on the surrounding brain tissues. So try to remove it as fast as possible and as complete as possible. The doctors are doing, mannitol and other steroids and other things they may give, but we in Ayurveda can remove this debris, so-called debris, by giving Nasya. Since it is foreign body, it requires to be taken out. So what is required is Sodhan Nasya. Immediately put Sodhan Nasya. Once the bleeding, this is a very effective method. Once you take the blood out, in the previous lecture I have already spoken about how the dosas are being removed from the site, either by absorption or by adsorption or by phagocytic activity or by any other chemical method. Nasya will clear off the extravasated blood from the brain very fast. With other supportive line of treatment we have to give. This is as far as brain is concerned. Now cerebral infarct, there also Nasya can be given, but that requires so much of thinking with respect to the clinical examination. Coming down to injury anywhere in the body, what you have to elevate is give analgesic and anti-inflammatory drug. So Sodhan Nasya is analgesic. Sodhan Nasya is anti-inflammatory drug. So give Nasya, the patient can recover faster. So there are very less chances of patient being shifted to the hospital if required, or you can treat in the clinic or treat at home. Even if patient is admitted in the hospital, with the help of appropriate doctor's advice, you can give Nasya even in the hospital. Give Sodhan Nasya. Nothing would happen. Pressure would recover faster. Hello? Yes?
सर सॉरी टू इंटरप्ट के ऊपर, आपका आवाज है ना बहुत ही लो आ रहा है, बहुत कम आ रहा है. अवधूत सर का अच्छा आया था, तो आई डोंट नो इट इज आपके साइड से प्रॉब्लम है या पता नहीं, बहुत ही कम आ रहा है.
Now, are you getting me?
No, same only, sir.
Hello. Is it okay now?
Without पहला बराबर है तो
आता बरोबर आहे.
नहीं
आता नहीं है आवाज.
सर हेडफोन रिमूव करके डायरेक्टली भी बोलेंगे ना तो आवाज आएगी अच्छे से विदाउट हेडफोन.
That's what I was trying. That.
Yes sir. I think it will be
अभी
better.
आवाज अच्छा है अभी.
हाँ, now
it is better.
better sir.
ठीक है. So I was talking about head injury, then I was talking about cerebral bleeding, and then I was talking about the cerebral artery blockages. Right? All three different cases and different approach with Ayurvedic medicines. What is more important? Think of clearing the debris, clearing the extravasated blood from the brain with the help of Sodhan Nasya. Here we may have to give initially Stambhan Nasya, but once the bleeding is stopped, then you have to start using Sodhan Nasya. It is as far as the head injury is concerned. Then as far as the injury to the other parts of the body is concerned, it may be CLW, it may be some fracture, it may be some other internal organ injury. What you have to do is give analgesics and anti-inflammatory drugs And Southern Nasya is analgesic and anti-inflammatory before even you shift the patient to the hospital if required. And in that case, you have to keep giving Nasya every 3 hours. The pain will reduce within no time. Then if necessary, you can shift the patient. You have got extra breathing time for management of the patient, either treat at home or you treat in the hospital. When the patient is already in the hospital, after taking due permission from the consulting doctor or the management, you can still continue with the Southern Nasya even in the hospital, even in ICU. It is very safe. Only thing you have to think of proper parameters where we can introduce Southern Nasya. Nothing else should be given as far as Nasya is concerned. It's only Southern Nasya. Right? Think of 3 properties of Southern Nasya. Is anti-inflammatory. 2, it is analgesic. And 3, what is the third one? Anti-allergic. In 3 conditions. 5th is also there, but then as and when time comes, we will discuss about that. But anti-inflammatory and analgesics you have to continue. Think of any
तो सर हम लोग इसमें सुंठ प्रदमन और गुड़ शुंठी दोनों दे सकते हैं.
हाँ, depends on the situation again. If patient is not able to lie down properly because of some injury in the neck or some injury in the head, then you have to go Southern Nasya, Sunti Pradaman Nasya, where he can inhale, he can snort the ginger powder through the nostrils while in sitting position. Once or twice, if you give Southern good Pradaman Nasya, Sunti Pradaman Nasya, once he is stabilized, then you can make him lie down, and if possible, you can give good Sunti Nasya. Start with Sunti Pradaman, then good Sunti Nasya. Right? Then you have to repeat, depending on the intensity of the pain, severity of the injury, you have to give every 3 hours. Sometimes I may have to give every 2 hours or maybe every 1 hour. Depending on the progress of the condition and patient's response.
Okay, right? Sir. Thank you so much.
Before asking the question, each of you should give your identity, your name. Yes. Anything you would like to add?
अवधूत सर, chat box मध्ये same question related 2 questions आहेत.
Yes. Sir, one question regarding the injury is there, that since the injury, we suppose that it is vata prakop. आघात हो गया है, इसका मतलब वात प्रकोप हुआ रहेगा वहां पे, फिर शोधन नस्य कैसे दे सकते हैं, ऐसा एक क्वेश्चन आया है.
This is abhigataj vat. Right? Any injury, it is abhigataj vat. Most of the times, initially, it could be samavastha vat. Abhigataj vat, which is of samavastha. So that time you have to give Southern Nasya. Then depending on the progress, then we have to change the Nasya if necessary. Pain comes down very fast.
So again in this you say that we have to use good shunti or shunti pradaman. And then in immediate succession we should be adding some grit nasya or tel nasya within 10-15 minutes.
We have to use good shunti nasya because good also acts pacify the vat. So even in abhigataj vat gives good shunti nasya. Then if necessary, either switch over to pradaman, shunti pradaman, or some other kind of nasyas.
So you are suggesting
only 24 to 48 hours. It is the first 8 hours are very crucial.
Because there will be shows around the aghat, that's why you are saying that shodhan nasya first and then we treat the abhigataj vat.
it is Abhigata's Vat, which is most of the times, if there is external injury, then you will find, so many external agencies coming in the wound, like debris or like, soiling of the wound that will develop, it will create Samavastha. So initially only you take care of Samavastha by giving good Sunti Nasya. Right? I've seen so many such cases of injury, giving good Sunti Nasya, and patient gets relief within no time, and then you have enough time for the management of the injury. If it is required, surgical treatment or CLW suturing. Sorry? Ima?
Nothing, sir.
Next, Avdut.
Dr. Pallavi, please.
Yes.
Thank you. Good evening, sir.
Good evening, Panai.
सर, तो ये जो हमारा सुंठी नस्य है, ये हम लोग कभी एब्डोमिनल पेन या कभी डेंटल पेन होता है तो उसमें भी दे सकते हैं?
You take one by one.
Okay.
Dental pain.
And और एक क्वेश्चन का पूछना है कि सुंठी नस्य देने के बाद इज इट कंपल्सरी टू लाई डाउन? सिर्फ पेशेंट ने बैठ के ही ले लिया और वो उसने लाई डाउन नहीं किया और सिर्फ बैठ के लिया तो क्या फर्क पड़ सकता है सिम्टम्स में? That's what I want.
Either you give Sunti Pradhaman Nasya or good Sunti Nasya. If you make the patient lie down in extended neck position by putting a pillow under the neck after giving Nasya, then the Nasya will spread in the brain very easily. But while sitting, only certain conditions where you cannot give in a lying down position, like very painful neck, cervical spondylosis, or pain in the posterior part of the head, where patient cannot lie down straight, then give Sunti Pradhaman Nasya in sitting position once or twice or maybe 3 times, and once the pain reduces, then you can give comfortable position, and then you can continue with the good Sunti Nasya. Right? As far as dental problem is concerned, you have to know the cause of the dental pain. Is there any swelling? Is there any gingivitis? Or is there any caries? Or is there any root canal infection? So in painful condition of the teeth, you can straight away give good Sunti Nasya. You can give every 1 hour if there is acute pain. Right? If there is recurrent pain and if the root canal treatment has not been instituted, then you can take help of other medication, in Ayurveda. Then you can subject the patient for dental surgeon. As far as other injuries are concerned, you can give good Sunti Nasya. It is better if you can make the patient lie down with appropriate position, taking enough care of the cervical spine. Then the results will be faster because it will spread very fast.
But when we ask the patient to do it at home, when we ask the patient to do it at home, sometimes they are not able to follow the instructions and not able to lie down. So what will...
Well, maybe if you follow the instructions properly and you practice it properly on the patient in the clinic, you are teaching the patient and the relative how to adopt the right posture for giving Nasya. Right? Once or maybe twice if you do it in the clinic, then patient will understand, they will learn very fast and they can do it at home properly. Right? There is no need of admitting the patient for Nasya. Right? Make sure to take care of the neck, particularly in elderly people where there is almost known cases of cervical spondylosis or unknown cases of cervical spondylosis or some other problem. Always support the neck with a neck roll. Right? Anything else? If you start practicing now, you will know very fast, very easy. What is required
and
is
in some chronic condition like necrosis.
Huh?
Can we use it?
Sorry,
Chronic
can you repeat?
condition like avascular necrosis or some bone damage.
You are talking about avian?
Avian, yes sir, avian.
Avian.
I
Here is
have
the
one
example.
patient, so I'm just thinking to do, but I am afraid to give.
See, what is the cause of avian?
Not a proper blood supply नहीं होता है वहाँ पे, and it gets bones get
Through what?
through blood vessels.
No, it is through the central femoral artery.
Central femoral artery, yes.
Right. The blood supply is not appropriate.
Not appropriate.
And there will be necrosis of the surface of the bone. So problem is not the bone. The bone is the effect. The cause is poor supply of blood to the head of the femur or acetabulum, right? So cause is the poor supply of blood through the central femoral artery. What is that cause? What is the samprapti of that?
Maybe kapha in arteries or amata, samata in arteries.
Usually it is vata-rakta.
Okay.
It is vata-rakta. But initially you have to consider that as a samavastha. Give Shodhan Nasya. And when you feel appropriate that now the Shodhan Nasya is not required, patient feels much lighter, better, then switch over to the Nasya which is suited for vata-rakta. Right. Here I remember, aortoarteritis. I think I have discussed this in earlier lectures. Aortoarteritis, similar picture. Aortoarteritis where patient will get the pain which would mimic like heart attack, coronary artery disease. Similarly, here also pain will be there, radiating to the shoulder, to the arm, to the back, wherever the course of the artery is there. Again, considering this as a vata-rakta, I treated one patient, and since 5 years patient was suffering from pain, right? So many dentists, so many physicians, so many ENT surgeons, so many neurophysicians, everybody tried, but pain was not going. 25 years old girl. When she came for the first time, I simply gave one Shodhan Nasya, good Nasya. Within 10 minutes, patient got the relief up to 50% first time. In next 10 days time, pain had gone. Right? Now here, there is no medical line of treatment in allopathy. They may give, vascular dilatation or so, but then surgical treatment is there, which would, they can give artery transportation, particularly artery which is involved on MR angiography. They will remove that artery and then they will give artificial artery. It's very risky, very costly. Results are not sure. Here you treat vata-rakta and patient can get rid of completely for lifetime. So vata-rakta, right? And I think Avadut will be able to highlight this avascular necrosis of the head of the femur. Avadut?
Yes, sir. Yes, sir. My father.
Practical experience.
Yes, practical experience. My father had this when I was in second year. So it is now almost 18, 20 years or more. But he was diagnosed with avian and he was advised surgery for the same. But at that time, sir started Ayurvedic treatment for him, and till now he hasn't have any problem with the. He even sits down. वो मांडी डाल करके बैठ सकते हैं और there is no problem with the avian as such. It is the history of avian, we can say.
It is a bilateral avian.
Yes, bilateral avian.
And even after surgery also, after hip replacement surgery also, patient cannot sit down. Here without surgery, in almost over 20-25 years, bilateral avian, he is able to walk freely, he is able to sit down, he is able to carry out all his work, right? Avadut? This is a best example of AVN. Vatrakta.
Yes, sir.
You have to think of the origin and the samprapti. Once you know samprapti in Ayurveda, samprapti parivarjan, simple. It could be avran and avrutta vat as a samprapti. But think of all the parameters and clinical examination and treat it accordingly. Start with Sodhan Nasya. Then appropriate stage comes, you can give Nasya for Vatrakta. Mind you, well, it is not bony problem. It is not bony problem. It is a vascular problem.
Vascular problem, yes.
The name
Sir,
itself suggests. Name itself suggests avascular necrosis. Necrosis has occurred because of avascularity, no vascularity. So the problem is vascular vessels, and the effect is seen on the bone, necrosis. So treat the avascularity. Avascularity is because of Vatrakta. Right?
Yes.
Don't be afraid of treating any such conditions.
Yes, sir.
See, it is an orthopedic problem. The cause is vascular surgeon. Treatment is done by orthopedic surgeon. You get my point? This is the controversy. Pallavi?
Yes, sir.
Are
Yes,
you
sir.
convinced? Are you convinced?
Yes, sir. I convinced. I am doing the treatment now. I will let you know in between if I have some query or I have some doubts. I will ask you definitely. The first time I am in the case of AVN, it's first case in my life I am come across. She is a lady of 34 to 35 years, and she is young lady, and she was diagnosed at a bilateral femur grade 2 AVN, and she was advised to go for the hip joint replacement, but they don't want to do that. So they came to us, and let's see, now I started Basti first, Pala Guduchadi Basti, and then Panchatikta Asthi Majja, matlab अस्थि आणि मज्जा घेऊन त्याची बस्ती बनवतीये पंचतिक्त भरड घालून दुधामध्ये असं. तर अशी बस्ती सध्या चालू केली आणि आता नस्य ऍक्च्युली आय वॉज क्वेरी की काल yesterday I have a camp in my clinic. It was anniversary of my clinic. So I had Agnikarma camp in my clinic. So she said कि क्या मुझे भी फायदा होगा? It will reduce my pain. So I was little bit in doubt. But she said she forced me to do the Agnikarma for her. And I did only on one side because she is having bilateral AVN. But on the right side she has more pain. So I did Agnikarma and she felt 50% relief in her pain immediately after the Agnikarma.
Very nice.
So
Very nice.
I want to ask the question ki if it is Vata Rakta, how the Agnikarma help her?
In Vatrakta Agnikarma, how it will work? Moment you give Agnikarma or with the karma, Vat from that area will start getting disintegrated.
Okay.
Right. This is how you can you can do parivarjan. But combine with the Nasya and you will get fantastic results. Secondly, you have to know the cause of AVN in such a young lady, 34 years. Whether she was put on steroid for a long time for some other cause which has precipitated AVN, then you have to take care of the positive factor like steroid. Right? So that also requires to be treated simultaneously.
Okay.
But you can try even with you have to see Vata's anuloman or pratiloman. Make sure there is pratiloman. See, Agni Karma, Vidya Karma, Basti will work, but how long the effect will be there, we don't know. Symptomatically, patient may feel better, but subjectively, patient should feel better in a long run. And there should not be any recurrence. Superficially, patient may feel relief in the pain, but inside, after 3 months or 6 months time, when you get the X-ray done, then it might have got aggravated. That may happen. So treat it adequately by combining 2-3 different mode of treatments. Right?
Yes, sir. Thank
So
you.
shall I say something?
Yes, please.
Now recently I have come across one consultant who has done studies on after doing Agni Karma, but he was majorly doing not the indirect method which we but then he has done in some of the cases after doing karma there is a radio changes which was new in me also. I heard he was picked up.
I could not hear completely. अवधूत तू सांग काय म्हणाला.
आशिष सर तुम्ही व्हिडिओ पण ऑन करा आणि पुन्हा एकदा सांगा ना, थोडा डिस्टर्बन्स येत होता.
ओके.
हा आता जरा
कोणी आलं का?
थोडासा लास्ट पार्ट येत नव्हता.
One of these are here.
आशिष सर नाही येते आवाज.
आशिष आवाज नाही आहे बरोबर.
Is it not now?
It's not audible.
Hello.
Breaking, sir.
Okay. Then we will speak later.
Yes, sir.
I will Doctor, simplify this. I will just simplify this regarding AVN, whether it is unilateral, bilateral. Before subjecting the patient for surgery, THR, you try with Ayurvedic medicines. The results are fantastic. At least 5 to 7 out of 10 can get rid of surgery. Only thing you have to consider Vata Rakta, and simultaneously you treat the necrotic part of the bone by giving osteocytic treatment, osteogenetic treatment, along with treatment of the Vata Rakta. Right? So then you can treat AVN successfully.
Dr. Sunaina, please on your video and ask your question.
Hello sir, myself Vaidya Sunaina Burgaonkar from Amravati. I want to ask that in case of that avian before 20 to 25 years ago, so how many times do you need to use Shodhan Nasya?
I suppose I have heard it properly. How long to use Shodhan Nasya? In what condition?
In avian case.
Okay. In avian, how long to use Shodhan Nasya? Shodhan Nasya is essentially treatment for the Samavastha. Right? In avian particularly, Samavastha is not as much as you feel. So we give Shodhan Nasya till patient gets converted into Niramavastha. And how will you judge Niramavastha? Simple. One word is Lagavta. Once patient gets Lagavta, you can switch over the Nasya for Vata Rakta. Right? Shaman Nasya or Bruhan Nasya. Initially start with the Shodhan Nasya.
उसके बाद में फिर से सामावस्था आती है, फिर से शोधन देना पड़ता है या शोधन नस्य देना पड़ता है?
नहीं, फिर से सामावस्था नहीं आएगी. फिर से सामावस्था नहीं आएगी if you have treated the patient adequately with शोधन नस्य.
ओके. और उसके बाद में ब्रूहण नस्य कितने सालों तक देना पड़ा? In this total 20 to 25 years.
Not necessary. Once Samprapti Parivarjan is there, then you need not give for such a long time. Even if you give, there is no problem, but there will be Ati Yoga of Bruhan Nasya.
Right.
You have to balance everything.
Right, sir.
Right.
Sir, I have
Dr. Aman.
हेलो
Dr. Aman Kaur.
यस सर सर मेरे वहाँ थोड़ी बारिश हो रही है, मेरी आवाज आ रही है क्या? थोड़ी नहीं मतलब
Yes,
काफी
बिल्कुल आ
बारिश की
रही है.
आवाज नहीं आ रही है?
नहीं सर मेरी आ रही है
हाँ आ रही है,
आ
आ
रही
रही
है.
है।
सर मुझे ये पूछना है सर कि लाइक इन वात रक्त देर इज रक्त इन्वॉल्व, रक्त की दृष्टि अलग से होती है एंड वात की भी होती है, तो रक्त एंड पित्त हैज गॉट आश्रय आश्रय संबंध, so will this shunti will it work on rakt too, like how Guru Shunti Nasya works on rakt? I want to ask this. Similarly, I have a related question also. Like in chemotherapy, many patients come to us after chemotherapy. They have a lot of pain because of the toxins accumulated because of that chemotherapy in the rakt. So at that time, which nasya we can use?
You can put on your videos.
Sir, it's raining very heavily, sir. There is no network as such. If I'll put on the video now, my audio will also go.
Okay. See, in any condition, any painful condition, usually it comes from samavastha. Whether it is cancer itself or the treatment given for the cancer, chemotherapy, radiation therapy or surgical treatment, there is a lot of samavastha. Our main aim is to correct the samavastha, and easiest way is to give Shodhan Nasya. And you will come to know how much the pain is reduced, whether there is any remission of the pain, still further remission of the pain, any condition. Majority of the problem, we encounter is samavastha and give Shodhan Nasya initially. Then after getting the response, you judge the response in periodic time. Then you can switch over to the other nasyas if necessary.
Okay, sir. Sir, in your audio, I have heard you were talking about musta also given as a nasya. So, in which conditions will use musta as a nasya?
See, any Shodhan Nasya, Shodhan Dravya, you can give in the form of Pradhaman Nasya. Any Shodhan Dravya. There are variety of Shodhan Nasya, but what is easily practiced, that is easily available, and it is available without any adulteration, without any tuna, lime, is a ginger powder. So I practice mainly on ginger powder unless there are specific indication, but I am not required to change my pattern of the Nasya in so many years of time.
Okay, sir. Even in severe Rakta Dushti also, we can use Gunashunti.
For example, what Rakta Dushti?
So, for example, sir, in cases of Kushth psoriasis, scalp psoriasis, Gatte psoriasis, Vicharchika, eczema.
See, all these skin conditions are majority of the Anubandhi is kapha, where Shodhan Nasya is indicated. But I'll tell you some funny stories also, like menorrhagia, menometrorrhagia, where there is excessive bleeding during menses, right? Even there you can consider there as not a Niram Pitta, it is Sama Pitta, and treat Shodhan Nasya and menorrhagia, menometrorrhagia, dysmenorrhea will come down. Similarly, acne, pustulous eruptions on the face, we think it is Pitta. It is Pitta, but little correction, it is Sama Pitta. So instead of giving Shodhan or Brown Nasya, you have to give, instead of Saman Nasya and Brown Nasya, you have to give Shodhan Nasya. And you will see in front of your eyes, within minutes, that pustules have reduced in size by giving Shodhan Nasya. This is Samavastha of Pitta. So any Pitta, or rather any Rakta, which is Dushita Rakta, is almost with the Samavastha. Treat with Shodhan Nasya and not Saman and Brown Nasya.
Sir, in Kama Pitta, we can use Gunashunti also?
Of course. Of course. Then patient will be benefited, you will be benefited.
Okay, sir. Thank you, sir.
Yeah, welcome. Who is there? Aman, na?
Sir,
Yes,
yeah,
sir. Yes,
Aman.
sir. Yes, sir.
Aman, I'll give another example of such bleeding. You know, like retinal hemorrhage,
Yes, sir.
right? There also very carefully you have to give Shodhan Nasya, very carefully.
Okay.
Recurrent hemorrhage or recurrent tear, retinal tear. Tear is also because of Vata and Pitta, that is Samavastha. By surgical treatment, by they may seal the ruptured retina, but after some times there may be some rupture elsewhere in the other part of the retina. But it is essentially Samavastha of Pitta and Vata. So give Shodhan Nasya first and then Shaman Nasya. Then there won't be any recurrence of the retinal tear or retinal hemorrhage. It's a very sensitive, very delicate situation, and you have to be very careful in giving Nasya. But it works wonder. Similarly, red
Sir,
eyes.
okay, sir.
Red eyes. I've got one 15-year-old boy who has this red eye problem since last 5 years. He cannot open his eye fully, and there is a lot of photophobia. He cannot go out under the sun, and he has taken almost 7 or 8 ophthalmologists' opinion and treatment. And in Ayurveda, he has taken 25 to 30 sittings of Akshitarpana. Now, patient has taken Akshitarpana so frequently, what else is left for us to treat in Ayurveda? Only one very good thing is left is, they have not tried Shodhan Nasya. Give Shodhan Nasya and treatment, the results should be immediate. And then you can give Akshitarpana or Shaman or Brahman Chikitsa. But Shodhan Nasya is prime important in such cases.
Sir, so in all Sam Vata, Sam Fit and Sam Kaf, we can safely use Gur Shunthi.
Depends, most of the times we give Gur Shunthi Nasya, but sometimes you may have to give Shunthi Pradhaman Nasya or any other Pradhaman Nasya. I would consider those who have joined this on this platform are very, very lucky, because in majority of the conditions in all over, Samatha is hardly noticed, hardly known, and hardly treated, and the treatment can go wrong. As I told you, this example of 25 to 30 sittings of Akshitarpana for red eyes did not settle down in 5 years of time, and got the relief on very first day by giving Shodhan Nasya. What does this indicate? We are missing out something more important condition of Samavastha, of any situation. Any given problem anywhere in the body, first you consider to be a Samavastha unless and until it is proved otherwise. Once you treat Samavastha, then get to the Shaman or Brahman Nasya, depending on the situation. Never miss Samavastha. Never ever miss Samavastha. And you will be really gratifying results. I do this Nasya Chikitsa on each and every patient, every day, in so many variety of conditions. Are you getting me?
Yes, sir. Sir, I have a patient also. Can you discuss about that?
A specific case, if it is short one, you can discuss. Otherwise, you can discuss later on. You can contact me or Hema or somebody. You can tell me what is the situation.
Sir, actually my husband has been diagnosed with mebonitis. His oil glands are totally blocked, and due to this his tear production is not there. And it's been a case like since 6 months. He has been visiting the ophthalmologist, but nothing happens. They have given antibiotics and everything, but still he doesn't have relief. Other than that, he also have allergic rhinitis. Whenever the season changes, he has bouts of sneezing, coughing,
and most of the time he is constipated, sir. So in that case also I can use Gur Shunti Nasya or Shunti Pradaman.
Has he taken opinion of Dr. Aman?
No, sir, he doesn't believe in me, sir. So घर की मुर्गी दाल बराबर. When he's just tired of all the doctors from 6 months and nothing is happening, then he's saying, अच्छा ठीक है, अब तुम ही कुछ कर दो. And then I give him in Elanese Kuzumbu. I said,
No. So that's what I'm asking. Has he taken opinion of Dr. Aman?
No, sir. He's sitting right in front of me and smiling.
This is a case of acute on chronic dacryocystitis, where there is the nasolacrimal duct is blocked. So there is lot of watering, lot of itching. I mean, lot uncomfortable situation. Over and above that, he has got allergic rhinitis. In both the conditions, there are some avastha. So for allergic rhinitis, and there is a continuous watering from the eyes, watering from the nose, and sneezing and headaches makes him uncomfortable. Just give good Sunti Pradaman Nasya initially till he feels comfortable. Then you have to take care of his infective process and inflammatory process. So that will be taken care of by only Sunti Pradaman Nasya. Give twice a day to start with for a few days. Then once he feels that Sunti Pradaman is reaching up to the forehead in a hairline, then you can start good Sunti Sodhan Nasya. He will give you a lot of embarrassment.
Let's see, sir.
Okay.
Thank you, sir.
You're welcome.
Dr. Pallavi Kothalkar, you want to ask a question?
Hello, sir.
Hi, Pallavi.
Hi, sir. सर मेरा क्वेश्चन ऐसा था कि हार्मोनल इम्बैलेंस या पीसीओडी जैसे बहुत सारे अभी कंडीशंस बहुत बढ़ रहे हैं, तो ऐसे कंडीशंस में हम लोग नस्य का उपयोग कैसे करें? जैसे कि हर एक पेशेंट में कुछ अलग अलग ही सिम्टम्स अगर सेम रहे तो भी हेतु अलग है, संप्राप्ति अलग है, तो कैसा विचार कैसा करना चाहिए ऐसे केसेस में?
It's the condition belongs to gynecologist?
Yes, sir.
It is not gynecologist problem. It is endocrinologist problem.
Yes, sir.
Yeah, so you have to shift your thinking.
Yes,
it
sir.
is HPO axis that is defective. Hypothalamus, pituitary, ovarian axis.
Yes,
Right?
yes, sir.
So that includes even TSH, that includes prolactin, that includes all
FHS, lowering FHS.
Everything. So this is samavastha. Where is pituitary and where is hypothalamus?
In brain only.
In the brain. That means it is these organs are
Urdhva Jatrugat.
Yes. Urdhva Jatrugat. Now, what is the best treatment for Urdhva Jatrugat rogas?
Nasya.
Then you have to decide. Samavastha gives Sodhan Nasya. Straight away, you will get results very fast. Once you clear off your HPO axis, then naturally the hormones will be secreted, will be in a balanced form. Estrogen and progesterone, right? Then PCOD, PCOS or similar problems can be corrected. You have to correct from the head, from the pituitary, from the hypothalamus.
Yes, sir.
Right? There is no successful treatment available in allopathy except giving hormonal treatment. They are giving external hormones for the balance of estrogen, progesterone. Here you can secrete the hormones naturally by giving Nasya and correct the hypothalamo-pituitary ovarian axis. So you have one up situation as compared to endocrinologist and gynecologist. Does it make any sense, Pallavi?
Hello, sir.
Pallavi, does it make any sense?
Yes, sir.
Correct the HPO axis.
And
result will be there in the ovary, in the uterus, lining of the uterus.
हाँ सर, मैंने अभी आपका मैंने परसों जब लेक्चर सुना तो उसके बाद मैंने 2-3 पेशेंट्स को देखा भी है। तो और सर मुझे अगला ऐसा एक क्वेश्चन पूछना था कि आप सामता और निरामता कैसे डिसाइड करते हो? आपके क्या आप मतलब आप किस लक्षणों?
Only one word, not even one sentence required to decide whether it is Samavastha or Niramavastha. After putting Nasya, Sodhan Nasya, if patient feels Lagavta in the head, so patient is moving from Samavastha towards Niramavastha. Very simple. And each patient, the situation will be different. So the number of days patient requires Sodhan Nasya would depend on the correction you get in the patient. And by the time next cycle comes, next menstrual cycle comes, you will come to know what is the correction in the menstrual cycle as compared to the previous menstrual cycles. Nothing to lose. You will be gaining, patient will be gaining.
Yes, sir. Okay, thank you, sir.
Okay. You're welcome.
Sir, I would like to add.
Questions. Yeah. Yes.
Just a minute. I would like to add because I think everybody is just getting confused with how to decide Sam and Niramavastha with the Nasya. So, if you have listened to the lecture properly, there is a slide which mentions that if you put so many drops, in how many drops does the Nasya reach in the top of the head? That itself is an indicator whether the person is in Samavastha or Niramavastha. So I think Aman or Sunaina asked the question that कब तक डालना है शोधन नस्य? So that is also one indicator कि वो drops around 1, 2, 3 या 4 drops में अगर यहाँ पर hit करने लगे. Suppose पहली visit में आपके पास patient आया and उसको 16 drops में भी ऊपर नहीं गया, तो you know that the patient is in complete Samavastha. Next visit पे आया 10 drop में गया, थर्ड विजिट पे आया 6 ड्रॉप में गया, देन यू हैव टू बी केयरफुल कि ये पेशेंट पच्चमान अवस्था में है. नेक्स्ट और विजिट पे आया 2 ड्रॉप में चला गया, देन यू नो दैट ओके नाउ ही इज कंप्लीटली निराम. सो दैट्स द टाइम व्हेन यू स्विच. जब 6 ड्रॉप्स भी होते हैं ना तो समटाइम्स यू गिव 2 नस्यास एंड आई थिंक वो सब नेक्स्ट लेक्चर में वी विल टेक. बट roughly if you start practicing Gurshunti Nasya this week on all your patients, then we can have more practical questions. मतलब आप जब तक करोगे नहीं ना तब तक ये पता नहीं चलेगा. आप डाल के देखो कि कितने ड्रॉप्स में यहाँ तक हिट करता है. ओके, once it hits you know कि हाँ it has reached. 16 में भी नहीं जाता, 20 में भी नहीं जाता, 25 ड्रॉप्स में भी नहीं जाता, you know it is super Samavastha. So there is no question कब तक डालना है. अरे वो नहीं जाता है मतलब आपको डालते ही रहना है. Every day that person has to put. लाघवता डालने के बाद भी नहीं लगेगी अगर बहुत ज्यादा सामता है. तो पेशेंट सिर्फ बोलेगा कुछ फर्क ही नहीं लगा. कुछ फर्क नहीं लगा तो समझना है कि वो सामता ही है. साम पेशेंट जो होता है ना वो ही ऐसे बोलेगा कि कुछ समझा नहीं. जो निराम है या अगर हल्की भी सामता कम हुई है तो दैट पर्सन वुड से ओके डिफरेंस लगा. Only because there are too many layers of toxins, the person says nahi samjha. So that is an indication when you should switch the Nasya. Otherwise, just keep going. Keep doing the Shodhan Nasya. Okay. I think that roughly solves the question.
Even 20 drops of Shodhan Nasya doesn't reach the top of the head, then don't increase the number of drops beyond 20. In that situation, you can increase the concentration by double. Increase the sunthi, double the proportion. Water and jaggery remains the same quantity, but sunthi should be doubled. Then suppose patient would have required 40 drops, Now 20 drops will start working. Then 19 drops will start working, 18, 17, 15. So patient will move from samavastha towards niramavastha, and proportionately patient will feel lightness in the head. Once he reaches the 4 or 5 drops, then he's almost reached niramavastha. And subsequently you will, this is the objective assessment. Subjectively patient also will feel lagavta, and then you will see the correction in the respective organ of the body, right? Next.
And one more thing, that when we put Nasya for the first time in the clinic and patient is having samavastha, that means that drops are reaching more than 16 to reach the top of the head or not reaching, then we ask patient to prepare Nasya at home, or we give Shunti Pradaman for daily use at the home. So till next visit, if we are giving medicines for 10 days, diet for 10 days, some postural correction for 10 days. After 10 days, in each day, patient prepares the good Shunti Nasya at home, or Pradaman Nasya, which we give Shunta from our clinic to the patient. They do the rice ginger inhalation, Pradaman Nasya, each day as suggested by us. And after 10 days, when the patient comes to the clinic, we put again and recheck in how many drops the Nasya is reaching top of the head. So daily basis, this Nasya is being done on the patient at home by patient himself, and each time we reconfirm what is the status of Samavastha, Pachamanavastha and Niramavastha.
Yes.
Right.
One more question regarding this, sir. So do we suggest to put Nasya twice a day in such Sama cases where 20 drops is also not reaching? So along with increasing the quantity of Shunti, if at all it is not reaching, then should we put Nasya twice a day?
After increasing the concentration by double, and if still doesn't reach, then you may give Nasya twice a day, morning and afternoon, or late afternoon or evening, not at night.
I think at that time we can consider about Pradhaman also in such case.
See, that is a special case. We use both Pradhaman and Good Shunti. Many times I use these two Nasyas one after the other in the same patient on the same day. Now what Pradhaman will do, it will spread in the head, right? And down the line, after 10 or 15 minutes or maybe half an hour, give Good Shunti Nasya. It will further take the action higher up in the brain, in the head. So that's a special case. Unless you practice regularly, you will not come to know exactly Pradhaman, to use Pradhaman and Good Shunti Nasya together in one same patient on same day. So don't try that. Initially you try with either Pradhaman or with a Good Shunti Nasya, Sodhan Nasya. We use 3 Nasya sometimes in one on same patient and same day, but that will require a lot of assessment, lot of observation, and you should be very, very confident. The results are really good. What surgery cannot do, your Nasya can do.
Sure. In cases of otitis media, we have given Shuntigur Nasya every 1 hour, and we have seen drastic reduction in the discharge. So not only twice, but every 1 hour also we have given, and not only one patient, but to multiple patients we have given it every 1 hour also.
Yes, very nice. You get the result. Particularly chronic suppurative otitis media, you have to give Nasya very frequently. But acute suppurative otitis media, you have to give Shunti Pradhaman first, and then switch over to Good Shunti Nasya in acute otitis media. chronic otitis media, no need of giving Pradhaman Nasya, straight away good Sunti Nasya. And at the same time, you have to treat, ears also with appropriate drops, ear drops.
Sir, in catarrhal discharge, in catarrhal conjunctivitis, again, Gudashunti has worked wonders. I've seen in at least 5 to 6 cases. And recently in this trigeminal neuralgia, that also I have used.
Ashish, you are ophthalmologist.
No, sir, I'm not.
You can give wonderful results by giving Nasyas. And what you have done is really right, perfect. In trigeminal neuralgia also consider Samavasa and then Shaman and then Brown Nasya. Yes, Ashish.
Yes, sir, I'm listening.
Tell me what else.
I just want to share, sir, with others that one of my earlier case, very old case, she had alopecia and madarosis, no hairs on the eyebrows. And in one of the Guru Purnima day, I asked you about her, and then based on your suggestion, I started with Nasya, and we gave it for a long duration. But then I had photograph of that girl having coming back hairs on her eyebrows. I just wanted to share that.
Yeah, again you go into the pathology.
Initially Shodhan and then
Yeah. Why there was no hair growth? Because the root of the hair was blocked by kapha. Very simple. Root of the hair gets blocked with kapha, so no proper nutrition reaches the hair follicle. Right? So there is no hair growth. You remove kapha. Removing kapha is Shodhan Nasya. And eventually you will see the cup is removed and now the nutrition is available and there will be regrowth of the hair, either eyelashes, eyebrows or hair. Right, Ashish?
Yeah. What kind of Bruhan Nasya should we use? I remember that time you have suggested and I have used Kumkumadi, but not the Kumkumadi oil which is available, but alone Keshar and ghee. So what is the another changes which you would like to say?
Kumkumadi, Ashish, Kumkumadi oil for what?
For Bruhan.
No, in what condition?
In this same case of madarosis after Shodhan.
If you do appropriate Shodhan, that is very important. Any Kumkumadi Grita will not work. Once Shodhan is completed adequately, then you can switch over to Kumkumadi Nasya and it will work wonder.
Okay.
Adequate Shodhan. Remove the block, remove the kapha or remove the samavastha by Shodhan Nasya adequately. And then you will get the result with either Kumkumadi Nasya or any appropriate Nasya, so the Brown Nasya.
Okay, sir.
So what about in the patients of melasma? I have been using this Kumkumadi Tel Nasya, but results are not very promising.
Have you tried Shodhan Nasya? Who is speaking?
Sir, Aman again.
Amar, first try Shodhan Nasya. You have to consider this to be melasma as a samavastha of pitta. Remove samata and then you can use whatever treatment you like, shaman or Brown Nasya. But Shodhan Nasya initially.
Okay, sir.
Then you will get gratifying results.
Thank you, sir.
Right, Aman?
Yes, sir. Thank you.
Yes, Avdut, Hima.
Sir, I have a question. Neha.
Neha,
Who is there?
sorry, sir, sorry
Yeah.
to interrupt, but I think 10:30 થઈ ગયા છે. If we take another question, I think another 15 minutes will go. If everybody agrees, then it's fine. Otherwise, we can take the session next week.
Okay.
Is that okay? We don't want to miss
Take
out
last
on any
question.
questions. We want to answer everything. So if everybody agrees to wait for a question, then we start with your question. Otherwise,
Maybe I can put it in the group, and next time when sir is taking the class, like we can continue with that.
We have to master Nasya Chikitsa. We won't leave you unless you are totally convinced and practiced.
Yes, sir. Okay, so I put the question in the group.
How many questions are left now?
Many.
There are many questions, sir. So
Okay.
they will
Now,
each take 10 and 15 minutes each.
So now we can do one thing. For today's lecture, the requisite was not requisite, but voluntarily wanted to go through the lecture. Listen to the lecture last lecture. Right. Now to continue with the next lecture on Nasya. Now one should try Nasya on their own or family member or the patients every single day. And next time your questions will be filtered by yourself. Yes, you will be much more polished in asking questions. बरोबर अवधूत?
Yes, sir. So that's what I was going to suggest, that this week everyone put Nasya for themselves first, then family members and with relatives, and we can have a better idea about the Nasya, first-hand experience of Nasya.
But suppose family members have no problem, then still they can put the Nasya?
Yes, why not?
Yes, of
Because
course.
there may be some samata.
Yes. Of course, everybody should put the Nasya, at least Gursunti Nasya.
Yes.
Unless there is rhinitis or allergic disorder, then at least Sunti Pradaman or Gursunti Nasya must be tried every single day. Difficult to say.
We will be sharing Gursunti Nasya preparation and Pradaman Nasya video in the group meanwhile. So everyone can go through it and see how we prepare Gursunti Nasya practical in clinic and how we do Pradaman Nasya for the patient. So accordingly you can go through it and start using it regularly.
If there was book on Sodhan Nasya or Sadhya Nasya, you could refer to the textbook, but there is no such adequately available textbook which can give detail about Sadhya Nasya and particularly Sodhan Nasya. So you have to keep trying. Trial and error will make you perfect. And this lecture series, will give you a lot of inputs. Are we done, Avdut?
Yes, sir, very nice. It was really very eye-opener and very informative, I guess.
Ashish?
Yeah.
I have found one more thing. Is everybody listening?
Yes, sir.
Yeah.
Yes, sir.
In general physical examination, we see flexion of the neck. We examine to see the flexion of the neck. flexion and extension, particularly flexion of the neck. So while lifting the head to see the flexion of the head, flexibility of the head, some of the patient you will find head is being so heavy, unduly heavy, disproportionately heavy. Note this point, underline this point, disproportionately heaviness in the head of the patient. Right? Give Sodhan Nasya, particularly good Sunti Nasya, I'm giving you the hint. After 10 minutes, again you try to lift the head of the patient and you will find drastic change in the weight of the head of the patient in just 10 minutes of time. Retrospectively, it will give us the idea that that heaviness of the head was coming because of the samavastha in the head. Where exactly in head we don't know, but somewhere in the Urdhva Jatrughat region there is a lot of samavastha which gave, particularly kaphaj, kapha-vataj, pittaj, pitta-vataj. Vataj alone will not give heaviness in the head even if it is samavastha. But when it is associated with kapha or it is associated with pitta, samavastha, it will weigh very, very much, So, but just by examining the patient, by lifting the head for to assess the flexibility of the neck, you will find this heaviness in the head. You will find in your cases also your number of patients in the clinic. So give us good Sunti Nasya, even if the patient has any other pathology, any other disease, any other treatment, give this good Sunti Nasya in heaviness of the head, and within 10 minutes you see again that heaviness has reduced considerably, and patient will feel lightness in the head immediately. And this is one point which I have observed in my practice. You all can try.
Sir,
How to repeat the question, please?
Even I couldn't hear you.
One part. Shall I repeat once again?
Yes.
Hello.
Yes,
Am I audible?
Yeah, Ashish.
Audible, sir? Yeah. So I am saying that one part is samatva, which you have mentioned just now. The other question comes in mind is it due to stiffness in the neck muscles? Because when we are trying to do flexion of the head.
See, even if there is stiffness in the head, in the neck muscles, paraspinal, cervical paraspinal muscles, then you will be able to differentiate that particular condition from heaviness in the head. You may feel tightness in the tightness in the neck, but not the heaviness. There is a lot of difference in
because I have never seen
tightness of the neck and heaviness of the head. There is a lot of difference. You will be able to differentiate both the conditions separately.
Okay.
And this is about the heaviness of the head, which we might not have acknowledged. Try this and you will be successful. While in tightness of the neck, it is purely because of the cervical spine problem.
And in the beginning, you mentioned about a person who is sitting and then we give Pradhaman, or in a lying down position we give Gudashunti. My question is, if there is injury and you are not aware what is happening inside, and if after putting first drop of say Shodhan, for example, if there is a bleed from the nose, epistaxis, then in such conditions what is to be done? Because that person will not be able to even accept it.
Before even giving Nasya to any patient, there are different parameters, examination point of view, even investigation point of view, you will come to know what exactly is going on in the head. And your BP, your pulse, everything, and oxygen saturation will give us the idea whether there is any bleeding tendency of the patient, or any previous episode of epistaxis, or previous episode of any bleeding anywhere in the body, or patient is on blood thinners.
Yeah, thinners.
Then you have to be very careful in giving Nasya. Give small, if it is indicated purely kaphaj or purely samavastha, then give Sunti Pradhaman or good Sunti Nasya for a short period. Again, review the parameters. And even if by chance patient has got, with no any other previous history, if patient gets, epistaxis, it is very simple. Stop the Nasya and give, apply Go-Grut in the inner side of the mucous membrane of the nostrils. Or give little ice packs or sprinkle water on the face and ask the patient to lie down. The bleeding would stop.
Okay.
Unless there is intracranial injury, unless there is any other cranial pathology, that is different thing.
Yeah.
Once you establish the diagnosis, freely you can use the Nasya in a given condition.
Okay. Yes, sir.
Ashish?
Yeah.
How much time we have now? It's over?
So already it's 10:40.
What to do?
Sir, next week. But
Next
the
week?
different time zones, sir.
I think by next week, so many of us will try Nasya every day.
But let me congratulate Hima and Snail and Avdut because they have also done a very good job and making us more easy. So I see all of you. Apart from the so hats off. So I can't say anything. बट जैसे आपने सर बताया ना कि ये पुरुषुंटी का तो व्हाट हिमा एंड स्नेक एंड अवधूत एडेड दैट वाज रिक्वायर्ड बिकॉज
Let me tell you one thing here. What Ashish is saying is also absolutely right. At least once you visit the clinic and practically if you approach, you see the patients being treated and you will be convinced. Anybody would be convinced. Practical approach, absolutely. It is worth spending few hours. Because it is not given in textbook, neither it is taught in the colleges, neither it is being practiced by the senior Vaidyas. What I am talking about is just Sadhya Nasya. Other treatment of Nasya as a part of Panchakarma is being carried out, but not Sadhya Nasya like this.
सर हाँ शीतल बोल रही हूँ सर एक पॉइंट ऐड करना था जो आपने मुझे बोला था जब मैं क्लिनिक पे आई थी जो हेड पोजीशन जो है वो कभी भी पेशेंट को मैंने उस टाइम पे बोला था कि बेड के कॉर्नर पे रह के हम हेड लो पोजीशन ले सकते हैं अगर पेशेंट काफी बार घर पे ऐसे ही करते तो आपने मना किया था कि उससे सर्वाइकल स्पाइन का इश्यू होता है तो एक वो ऐड करना था कि हेड पोजीशन जो क्लासिकल बोला या सपोर्ट लेके करना है
It has already been mentioned.
Yes, sir.
Lot of emphasis has been given for the Nasya. I think even the slide is there about Nasya, picture is there. And we have also emphasized the position of the Nasya not to give any injury to the cervical spine. Right? Yes, Avdut?
Yes, sir, absolutely. सर बरेच क्वेश्चन्स बाकी आहेत आणि आज रात्री कोणाला झोप लागणार नाही एवढं नक्की आहे.
एक गोष्ट सांग आताच की आज रात्रीला नस्य नाही टाकायचं शोधन नस्य नाहीतर झोप नाही येणार.
येस सर.
डे टाइम टाकायचं.
येस डे टाइम टाकायचं. या
डे टाइमला.
येस. सो
unless one wants to remain awake at night for some special duty.
So we will meet.
Sir, this is Hina.
Yes, Hina.
Sir, before we leave, I will discuss this in next one, but if at all I cannot attend next one, I just wanted to let you know, I had a patient in Canada, severe concussion, and then chronic headaches, chronic vertigo, everything taken care only by Nasya. And now she is able to fly, she is able to travel. So I dedicate that to you, sir. You gave me the confidence to believe in Nasya Chikitsa, and I could do it.
Dedication is towards Ayurveda itself, and it's good that you have done such a great job in such a situation, very delicate situation, that too abroad.
Yes, and I couldn't see her because it was during pandemic. So everything was done on Zoom, and she could still be benefited with it.
Hina, you put this on this group. Put the details of this patient.
Definitely.
So all will be benefited. Good. Congratulations, Hina.
I don't deserve it, sir. You deserve it more than me.
The thanks goes to the Ayurveda itself and our all seniors practitioners. It's good that you have practiced it properly.
I'm trying.
And what was the allopathic doctor's review on this same patient before and after putting Nasya? That also you can mention, you know.
Yes, sadly, I will never have that data, and I will tell you why. Because here, of course, many of the patients or the clients, rather, they prefer not to disclose that they are going under any alternative or integrative therapy.
See, there is a solution to that also. You need not mention the name of the patient or name of the doctor or name of the institution where the patient has taken the treatment. But you can say this is the female of this age, you know, came with this problem, concussion, then developed this hospital. That is allowed.
Yes.
Without putting any name, without putting any specification.
Yes.
But medical
history, based on that, I do it.
Yeah. You must tell. You must give this in on the group. For the benefit of so many other doctors, you know.
Yes.
They will get confidence in practicing Nasya.
Absolutely. For case studies, I do that.
Yeah. Good. Very good, Hina. I appreciate your courage.
You gave me that courage, sir.
Very nice.
Sir,
Hima?
Sir, can I share one personal case with the result only with the Nasya?
Who is there?
Sheetal.
Sorry, ma'am.
Yeah. Yes. It's very late. It's very late. Yes. Yes.
We'll give you the time.
Okay, I will put in the group. Yeah.
Okay, so with your permission, we can conclude today's session.
Okay. Thank you very much, all of you, and all the best. And good night. See you soon next time.